think it's true throughout Europe as well as the US and the UK. And I think the reason is that our whole approach to health is that after a disease is diagnosed, we treat the disease. Before it's diagnosed, we don't have much health care that's oriented toward preventing the disease. So we're not going to really increase health span until we're able to prevent the disease and prevent the disability that's associated with the disease. So we really have to change our approach to thinking about health and actually intervene earlier if we're going to improve health span. At a population level, I think what we're getting is really clear evidence that early life is so important in terms of the health people have when they're old. So I think perhaps the biggest effect at population level could be supporting children, supporting families, providing medical care where it's needed to children, providing support for families, reducing the stresses that people have at the time when they're raising children and needing to work and provide for a family at the same time, both in terms of time and money. Certainly in the United States, that's a gigantic problem. It's less of a problem in Europe because the support systems are stronger, but it's very clear that early adversity has an effect that stays with people. And the other thing I think that we haven't done is we haven't treated mental illness as a real risk factor for all kinds of poor health. And the more we learn about its effects, the more we know that mental illness actually results in physical illness. And we need to treat mental illness early and probably more thoroughly than we have. And that's probably across the board. We started with physical illness, in terms of how our health system was organized, because that's what seemed the most needy at the time. But now I think the whole idea of mental illness just needs a lot more focus than we've had to date. It's hard to answer that question because I think either you can group everything together and you can make one indicator. And for instance, that's what WHO has been focusing on most recently. They have sort of proposed an indicator they call intrinsic functional capacity, which basically puts everything together: sensory, functioning, cognitive, social, and into one indicator. That might be okay for some things because you'd have a measure of how people are, their entire well-being across society, and maybe that would be good. For me, I want to know where things are happening, so I prefer indicators that are a little more specific to specific outcomes. I think a functioning measure is probably good for getting an overall idea of what's going on in societies, but it isn't particularly good for knowing where to have medical intervention. So I think you need different indicators for different types of policy questions. And there are a lot out there. I think they all have their own use, but they're not all the same. And so you need to think about what it is you really want to say or what you want to test, I think. And while I do believe that all these things are related and that the aging process, there is one underlying aging process that affects all of these health outcomes, I think they can proceed at different rates. So I think it's useful to distinguish among those things. If I didn't like what I do on a day-to-day basis, I wouldn't be doing it. I would be retired. So obviously I keep working because I like what I do. So that means I like the activities I have day to day. If I prefer to do something else, I would be retired. I think you need to be able to have a set of activities that interest you and that you feel are worth spending your time on throughout life. And the more that's in your work, the longer you're going to work. the more you find it outside of work, the earlier you're going to retire. My husband just died a couple months ago, and he retired at 92, and his last book, Cambridge University Press, came out in January, the month after he died, at 98. So I don't want to work that long, but I think I'm at a stage where I'm working on very interesting questions, and I think they matter, and I like working. There's time and there's money, and those things are limited, and that's what gives people stress, I think, aside from, there can be many other things that are individual and personal things, but I think we have, I would put stress in the box of sort of mental health, and I think, yes, we have not paid enough attention to that. Again, I note that the National Institute on Aging, which in the United States, you don't know exactly what's happening there from day to day, but just yesterday, they put out a call for work on stress. So I think, yes, that is one of the things that we probably have neglected, because we like things that are easier to measure in general. And I think the idea of figuring out how you best get at stresses across the lifespan is important. And people have, stress is not one thing for everybody. You can't measure just objective stress. You have to measure people's reaction to it, because how it affects their health depends on how much they are stressed by outside stressful conditions. So some people just, toss it off and it doesn't hurt them. Other people ruminate about things and it becomes a real issue in terms of how it can affect their long-term health. So there's individuals' reactions to stress and there's outside stressors, and those two things together need to be really clarified to understand how that's going to affect somebody's life, I think.